Hello. Today is Monday, March 11th. It is just over a month since the bad MRI. And so I'm still just wanted to give an update. I figure it's easier to do it this way because I just cannot remember who I've told what and, what level of detail people want or need or whatever. So yeah, it's been just over a month since the bad MRI, and I am currently on convalescent leave from work in these beginning stages, which has been incredibly helpful. It was really, really, really hard to even consider that, but my oncologists and my PCM, my military doctor, have pretty much agreed that it's probably best for me right now while I'm not weight bearing on the right, and I'm also sometimes on some pretty heavy pain meds, and so I'm just super foggy, and all I do is really sleep. And it's not all the pain meds because I'm not on them all the time, but even when I'm not, I'm exhausted. I can sleep pretty much all day. Anyways, this is not about that. This is kind of just to get out there what the treatment plan will be, because that seems to be the number one question I've been getting. And so it's gonna consist of systemic therapies, which are medications, so Lupron to shut my ovaries off again, an oral like chemo targeted type chemo med that will be every day or twice a day, I can't remember. I shouldn't lose my hair on this one, so it's not like the original chemo that I went through back in 2020. And then another injection, a anti-cancer drug injection, and then an infusion, so an IV administered medication to strengthen my bones. That one I'm concerned about only because one of the side effects is bone loss in the jaw. And I've had a lot of issues with this tooth number 30 during chemo the first time, and even before that I had several root canals on it, and it's given me a lot of trouble. So I have a dental implant in there now, and it's doing really well. But with this drug, I'm a little worried about it, but I do need to get dentist approval or dentist. I don't know if it's approval or I don't know, whatever. I have to have something signed by my dentist saying I can do it. So we'll see how that goes. And then, so systemic therapies is number one. That's all the medications and drugs that are handled by my medical oncologist. Then there's radiation. And so some of the meds I've started, some of them I also opted into a couple of studies. One study adds a medication, a proven medication that's already gone through all of its trials and stuff. It adds it to the standard of care. So the standard of care is currently, the Lupron oral medication, the injection, and the Zometa, the bone strengthening infusion. So that's the standard of care currently. And so what this study is doing, it's adding an additional medication on top of that has been proven to add to the standard of care. And so they're wanting more data to make it part of the standard of care. And so I opted into that. And then another study that is studying the effects or I think long-term survival of young women with breast cancer diagnoses who have had children versus who've not had children. So I don't really know the details on that, but there are no additional drugs or appointments or anything like that. So it's just them kind of needing consent to dig through my records, which I'm okay with. At this point, everyone knows everything about everybody. So, yeah, so hopefully that can help in the future. And then, so that's the systemic therapies, is all the drugs. And then there is radiation, which I will definitely have on my hip. It's just 5 days, 5 consecutive days. So 1 week of radiation, and that's it. Last time it was Monday through Friday for like 4 or 5 weeks. So, it really wiped me out. So this time I should have minimal side effects. Still on the fence whether we're going to radiate the skull. Good news is there's no cancer in my brain, so that we can see right now. So that's great news. That was a win for sure. But it is in my skull, so like right around here. And I do have some pain. I was having a lot more before, but I think these pain meds are really helping. So I think I'm gonna opt to try and see what the systemic therapies do for the cancer in my skull before I actually do radiation. Number one, I don't really want radiation that close to my brain, even though I understand they're not radiating the brain. I still just don't want to deal with it. And then also, I would lose hair, so like have a bald spot here with no guarantee that I'll grow back. So I know that maybe sounds a little bit vain, but at this point, my radiation oncologist is very comfortable with that approach of seeing what the systemic therapies do before we jump to radiation on the skull. But I will definitely have it on the hip. Sounds like we are going to do that before surgery, primarily because it's just easier to get in that way. And so then the third piece is surgery on the hip. So for some reason, when I hear stuff and then there's not a whole lot of action around it, I kind of assume that it's not going to happen. However, the ortho oncologist, whatever, osteo, or I don't know what the hell he's called, but the bone cancer doctor, he says, it sounds like, based on the scans and stuff, he really does want to do surgery. Which I think it sounds like a rod at like the top of my femur. I don't know. Well, I see him on the 22nd, on March 22nd, so in 11 days, which still feels like a really freaking long time. So that's kind of what it's like in the beginning. It's a lot of appointments. It's a lot of last minute stuff. They'll call me one day and say, hey, can you come in now? Or, hey, can you come in tomorrow? And that's another reason why it's great to have the convalescent leave on paper, because I'm answering my phone all week, which is like answering every single call. And so weekdays are still a little bit stressful because I'm mostly sleeping, but then I have to answer my phone every time it rings, essentially. The Air Force also is trying to enroll me in the Wounded Warrior program, not the project, not the nonprofit or alleged nonprofit, not that one. It's an actual program that is sanctioned by the I think it's DOD. It's congressionally mandated, all that stuff. So more to come on what that means, but it's always a battle as a guardsman, even when you're on active duty as a guardsman, because I don't understand why it's such a confusing, like, first time, or every time's the first time for everything, it seems like, and so I have a lot bit of anxiety going around that too. So anyways, all that to say, treatment plan is rolling, and I've started one of the meds. The other meds will follow. But yeah, so to sum it all up, diagnosis is the same: metastatic, aka stage 4 breast cancer, not bone cancer. I have to be very clear about that, 'cause bone cancer and breast cancer mets are very different. So yeah, same diagnosis, same locations that we know the cancer is in right now. And it'll consist of systemic medications, systemic therapies, radiation, surgery, and then of course pain management. So it's all considered palliative, not curable, but treatable at this time. So that is pretty much it. I have to hop on this work call here in a couple minutes. So